Hi everyone! Welcome back to our channel. I know it's been a while since nag-upload kami ng video, but we got so busy. And as you can see, nag-change ang aming channel name from Cal and Faith to the Parish Family. So if you are not my Facebook friend or a personal friend of mine, maybe you are not aware na we're actually expecting baby P. So the reason why I actually did this video, it is because this pregnancy has not been easy. Napakadami pong challenges from the moment I discovered I was pregnant until now. But by God's grace, I'm still pregnant, and we are praying and hoping for the best. So if you can hear some fireworks sa aking background, it is because I'm making this video December 31st because this day is very special for us, and I'll explain to you why. So kung makikita niyo po ang title ng video, it's about preterm labor scare. So, ikwento ko po sa inyo kung anong nangyari. The reason why I decided to share this video, it's because first, it is for me to be reminded of milestones, challenges that I needed to overcome during this pregnancy. And I also wanted people to be aware, you know, yung mga buntis or may planong magkaroon ng family in the future. And I know iba-iba naman yung pregnancy journey natin, but I just wanna share to you what happened to me. So, second week of December, I am already around almost 27 weeks. So, I am observing that I'm having yellow stain in my panty liner. So, kung na-experience yun na pong magbuntis, alam nyong dumadami yung discharges natin while we're going through the pregnancy. So, this is the first time I saw some yellow stain. And then, if you just know kung ano po yung aking naranasan with my first trimester is I have enough reason to be paranoid and to be worried. So, I know maybe I'll make a different video about it, pero this one is just specifically about the preterm scare. So, nung na-observe ko po na may yellow stain ako sa aking panty liner where I get used to using because of more discharges na, I tried to call labor and delivery triage and ask them if it is normal, if it is fine. I just want to have peace of mind. So, sabi po ng nurse is I should use Monistat, which is for yeast infection, because pregnant women are also prone on having yeast or different kinds of infection po sa ating private part. So, sabi niya, gamitin mo yan ng 7 days and we'll see. So, while using the Monistat cream, nawala po yung yellow stain. But after the 7th day, nakita ko na bumalik na naman yung yellow stain. So this time, I am already 27th week. So I'm so sorry if I'm looking down dahil meron ako ditong ginawa na record just so I won't forget anything. So December 17, that was Friday. We're actually having work Christmas lunch. Very busy ako noon. I was not able to drink a lot of water. Tapos naka-experience ako ng back pain, and then the yellow stain is more. So tumawag po ako ulit sa labor and delivery triage, and they actually recommended me to come into the hospital and be evaluated. So the reason why I went there, remember, is about the yellow stain. So they actually use this speculum. So it is equipment para buksan nila ang iyong private part. And then they actually saw na, no, you're not having infection. Discharge is normal. And then they actually collected the sample. And then they haven't explained to me yet para saan yung sample na yon, but I'll let you know later. And then I arrived actually in the hospital around 2:30. So I am currently in labor and delivery. The reason why I was here is because meron akong discharge, and then it turns out na normal yung discharge na reason why I'm here. But they discover na I'm having contractions, and they wanted to resolve it while I'm here. So everything's being monitored. Baby is doing okay in terms of heartbeat and moving, pero I'm having contractions. So they gave me terbutaline, which is to slow down the contractions, and I'm being monitored until now. They also did a test called fetal Fibronectin. According to the nurse, 98%. If it turns out positive, I will deliver the baby in 2 weeks. Pero pag negative, everything's good. Lord, 2 weeks is for just 29 weeks. Baby, stay put. Kaya natin to. Lord, if you can hear me, keep the baby safe. Praying for the best. Tinapos ko pa rin yung lunch sa work because I don't wanna really dwell on it. I don't wanna worry too much. So, pagdating mo doon sa labor and delivery, they actually monitor you with first monitor is for the fetal heart rate and fetal movement, and the second one is contractions. Surprisingly, is they discovered that I'm having premature contractions. So contractions or false contractions called Braxton Hicks, normal po siya. It's like yung abdomen mo is practicing para sa labor, but it should be irregular and not close to each other, yung contractions mo. But they observe na mine is irregular, pero marami akong contractions na magkakadikit. So it started to worry the doctors or the OB. But the other problem is actually I cannot feel the contractions, so I'm not aware. I went there for the discharge, not for the contractions. They just discovered it. So first they gave me terbutaline, that's intramuscular. It is actually used in the event of preterm labor to help relax uterine muscles and stop contractions, but unfortunately it did not help. So tinurukan ako dito, then hindi nag-work, hindi nag-stop yung contractions ko. So sabi ng midwife or ng doctor din is that okay, i-check natin yung cervix mo, and then we will actually measure the length. So nung chinek po nila yung cervix ko, it's still closed. And then the length of my cervix according to the OB is 3.1 cm, which is good and stable sa age po ni baby. And then just remember that yung cervix mo actually gets shorter and shorter habang papalapit ka sa labor or pagpapanganak. Tapos, ang kinalek daw nila sa akin for labs is called Fetal Fibronectin test. So let me read to you. According to my research, fetal fibronectin, ito po yung protein that believed to help keep the amniotic sac glued to the lining of the uterus. So ang amniotic sac is the fluid-filled membrane that cushions your baby in the uterus. If this connection is disrupted, fetal fibronectin can be released into secretion near your cervix, and then the connection can be disrupted by an infection, inflammation, separation of placenta from the wall of the uterus, uterine contractions, or shortening of the cervix. So, nagiging present ang fetal fibronectin because of those reasons. And according actually sa kanila is that they're actually concerned that I may be going to preterm labor very soon. So, ang fetal fibronectin po is, sabi nila, only 20% of pregnant women are testing positive with it kapag hindi pa sila term. So, meaning, 20% po yung pwedeng maging risk sa preterm labor. So kapag nag-positive ka po sa fetal fibronectin test, it gives you 50% chance of giving birth in 2 weeks. Tapos, kapag nag-negative ka naman, then you are unlikely to undergo or experience preterm labor in 2 weeks. So, sabi sa akin ng nurse, 20% lang yung nagpa-positive dyan, so I don't think you're gonna be positive. Tapos, unfortunately, bumalik po ang result and it is positive. So, grabe yung worry ko kasi sabi nga nila only 20% nagpa-positive and 50% pag nag-positive ka is manganganak ka in 2 weeks. So, if I am 27 weeks by then, 29 weeks, baby is too young. It's too early para ipanganak si baby. Okay, so, but the thing is, I am not dilated. My cervix is not dilated. Contractions are there, pero hindi naman siya strong. It's not something that I feel like mag-aano na sa preterm labor. And they said the only problem is the fetal fibronectin test. That is something that they really worry about. So, ang sabi ng doctor is that, you know what, well, to be sure, we're just gonna give you betamethasone. So, betamethasone is an antenatal steroids that are commonly used to stimulate fetal lung maturation, particularly in pregnancies that are risk for preterm labor. So, ibibigay sa yung betamethasone, 2 dose siya. It's either 12 or 24 hours interval. Pero yung sa akin, binigay sa puwet ko, sa left side. Sobrang sakit. Very painful. Burning sensation. Sobrang sakit talaga. And that's the first shot. And I need to go back to the hospital after 24 hours to get my second shot. So that's not something I'm looking forward to. Makukuha ko siya. So, sabi dito, research has shown that glucocorticoid administration has a significant beneficial effect for preterm births as it decreases the incidence of respiratory distress syndrome in infants delivered between 24 weeks to 34 weeks. So this lessens daw the chance na kapag pinanganak ng maaga si baby is that they'll be needing ventilators or oxygen and those kind of things. So, after, imagine, 2:30 po ako pumunta sa hospital. I was discharged around 8:30 na. Kasi I got my injection ng 7:30. So, December 18, Saturday, bumalik po ako sa hospital ng exactly 7:30 to just get my second dose of betamethasone. But guess what? Hinok nila ko ulit dun sa monitor with the fetal movement, heart rate, and contractions. And they gave me the second dose of betamethasone sa kabilang side naman ng puwet, which is really, really painful. So, another OB went and checked na ang aking cervix length. Gusto daw nilang i-check kung umikse yung cervix ko. Unfortunately, from 3.1 cm just after 24 hours, it got shorter to 2.3 cm. So, ang sinasabi nila sa akin, it's considered short cervix if it is less than 2.5 cm and you're very high risk of preterm labor. And imagine I'm 2.3 cm. So that really worries the OB na nag-check sa akin. So actually, instead of just discharging me that day, they decided to admit me for 24 hours para bigyan ako ng magnesium sulfate. So I am admitted for 24 hours close monitoring. My cervix length yesterday was around 3.5. Today when they rechecked it, it is between 2.3 to 2.7. So just within 24 hours,
my cervix got shorter. So right now I'm receiving magnesium sulfate for 24 hours. They're monitoring baby's contraction, baby's movement and my contractions. I have compressions on my legs to avoid blood clot, and hopefully our goal is to bring baby to full term and not to be in labor for within 2 weeks because of a positive fibronectin result.
So far, umiiksi ang cervix ko, but my cervix is still closed. Contractions are still there, pero lesser na siya than nung first day na pumunta ako. But they decided to give me 24 hours magnesium sulfate via IV and to be close monitored. So magnesium sulfate is used in pregnancy to prevent seizure, to worsening preeclampsia usually. And another thing is to slow or stop preterm labor. And also, magnesium sulfate gives neuroprotection for the baby, lalo na sa mga preterm babies. So, in preterm labor, ginagamit din yung magnesium sulfate so that the steroid, yung betamethasone na tinurok sa akin sa puwet ko, will be able to, parang bigyan siya ng time to be able na mag-work well siya for lung maturation. Because what if nakuha ko yung injection then suddenly nanganak ako after several hours. So, hindi talaga na-absorb ni baby yung gamot. So, sabi nila, stay 24 hours para may time yung steroids na makahelp sa lung maturation ni baby. Now, next is yung side effects ng magnesium sulfate while I'm in the hospital is like flushing or hot flashes, feeling tired and lethargic, nausea, vomiting, dizziness, blurred vision, muscle weakness.
So right now I have bathroom privileges, but they need to monitor my INO because of the magnesium sulfate, and I'm high risk for falling too because of the medication. Vital signs being monitored every 4 hours, and according to the OB, after 24 hours of magnesium, we need to re-evaluate or re-measure my cervix, and if it is the same length, then I think they will be able to discharge me.
Guess what? Na-experience ko siya lahat. So usually kapag nasa active labor ka na and they're giving you magnesium sulfate, you're actually on bed rest, naka-Foley cat ka, strictly bed rest ka, strict bed rest, naka-Foley cat, and you don't eat anything for possible C-section. Pero because I'm not in active labor, I have bathroom privileges and I'm walking. So, grabe, imagine niyo na lang yung blurred vision, very weak. I'm almost fainting every time I go to the restroom. And they actually have to monitor your intake and output sa liquids because magnesium sulfate can also cause kidney failure. So continues na 24 hours monitoring ako with magnesium sulfate. And actually, my contractions is nako-control siya. And I don't have contractions for almost the whole 24 hours. So that's a good news. So Monday morning, another OB came in to have transvaginal ultrasound done to check my cervix length again, and praise the Lord, by God's grace, from 2.3, it is now 2.8. So hindi na tuloy-tuloy yung pag-short ng aking cervix. So I was discharged. But on modified bed rest. So ang sabi sa akin ng doctor ko, it's controlled for now, but you are still risk for preterm labor. So to be sure, you will be ordered to not work and be on modified bed rest. Modified bed rest means you can stand up, alam mo yun, to do daily task, but you cannot be standing up for extended hours, even sitting down on extended hours. And of course, you have to go to the restroom. So, hindi ka pwedeng mapagod, hindi ka pwedeng ma-stress, ma-exhaust, and all those kind of things. And when I got discharged, doctor actually ordered progesterone vaginal insert. So, this is something that you have to put at bedtime. So, progesterone is something that people who have infertility issues use. Kapag nahihirapang magbuntis, ginagamit ang progesterone to help you get pregnant. And with my situation, I'm using it because I want to stay pregnant. So sa hospital, ang sinabi kong goal sa kanila is first, I want to stay pregnant, and second, we want to reach full term. So they actually requested for me to go back after the 3 weeks modified bed rest. So if that's 3 weeks, then I'll be 30 weeks. Baby will be 30 weeks by then. So today is December 31st, and today marks our 2 weeks. So I praise God na we did not go through preterm labor for the 2 weeks na sinabi na we're 50% on experiencing having preterm labor. So, thank you talaga. Si Baby P has been active and helped me to not worry so much kasi nararamdaman ko siya every time. Very active na siya, and this age, gestational age, 29 weeks, is napaka-active ng baby. So, I'm waiting another week. Hopefully, Lord, protect us and the baby. Then we will be 30 weeks. Then we will be re-evaluated kung nasaan na kami sa pregnancy. So that's the story. I'm just so happy to share to you na I know I posted in Facebook about what's going on, and a lot of people prayed for us, and we're really thankful and grateful na you prayed for us, and God listened to our prayers. And I hope and pray na talagang ma-reach natin ang goal, which is to have baby be delivered full term. So that's it. To follow our journey and to be updated with our story. I hope you learned something about this experience. And again, thank you for praying for us, for our family. We really appreciate it. Happy New Year, everyone. And if you want to hear more updates about this pregnancy journey, just don't forget to hit the like and subscribe button. Thank you so much, everyone. And I hope that we will all have safe and wonderful year of 2022. Bye-bye!